Hi everyone, this is Stefan, the orthodontic specialist. Today I have the honor for my next straight talk, not only to invite one of the best orthodontists I have ever met in my life and best lingual specialist in the world, but also a very dear friend of mine, Giuseppe Scuzzo from Rome. Today it's all about orthodontics and lingual braces and aligners and the future of orthodontics. So thank you so much, Giuseppe, for accepting the invitation. I'm not sure if it's your first podcast ever, but I think it is. It's a new media, so that's the modern world. So I'm sorry that I throw you in the cold water with this podcast, but I think it's really important to have a chat about lingo. So thanks very much for accepting the invite.
Uh, Thank you, Stefan. Thank you all for to be here. And Stefan, you always spend a nice word to me, and maybe you are too kind. You know very well we have a very deep friendship, and I'm really honored and I'm glad to be here tonight to discuss maybe about lingual aligner and the future for invisible orthodontics.
Well, let's jump straight away in the topic. So obviously, Giuseppe, you're doing orthodontics for a few decades now. And I want to know, first of all, how did you come first in contact with invisible orthodontics? And why were you so eager to do something so different at the time? Why were you one of the first adopters of lingual braces at all? What was it for you that was so fascinating about lingual braces?
Uh, so I start my cases. First lingual cases is in '83. Uh, so I was really impressed when I knew about this technique, and because I believed that this approach could be the future of lingual orthodontic. At the time, didn't exist aligners. Aligners came later in the market, and maybe probably there are some. I say maybe miss confusion about invisible because honestly the really invisible is lingual. I consider aligners aesthetic orthodontics, even is really and less conspicuous braces. Uh, Metal train track are not the longer the only route to straight smile. And the adult always are looking for alternative such as aligners that and now is the most probably used invisible appliance and lingual braces that of course, is totally hidden behind your teeth. Okay.
I think,
So,
can I just say to you, I think you mentioned here one really important thing that I think nowadays it is the belief of patients and dentists and orthodontists that there's only one orthodontic tool available, which is a clear liner. But what you said is, and what I experienced as well as for the adults actually, um, they are quite keen on also having another option of, for example, lingual braces because they are invisible. And also, most of the adults I see, they don't want to have something removable because they are interacting with customers, they're going out for dinners, business meetings at any time. They find it inconvenient to remove and put aligners in all the time. They rather would go to a specialist like yourself to have to spend some time there. They do their job and then they can go back. And in terms of also efficiency, I think if you are skillful with lingual brace, I think we both could agree on that you're much more efficient in the way you move teeth from A to B. What would you say to that? What is the difference in terms of efficiency between lingual braces and aligners?
Uh, Honestly, about for my experience, aligners works very well for simple and medium average difficult cases. Okay, lingual is it's okay for almost all cases. So uh, uh, aligners that imply that the straight teeth using removable plastic aligners are some maybe some more small biomechanical problem in controlling some movements, and so are a little bit are more difficult, especially in controlling the posterior area, comparing it to lingual orthodontic that is much more efficient and much more faster. So, uh, of course, in analyzing which appliance could be best for every cases, we need to select the right case for with the right appliance. Uh, uh, Today, maybe the literature, the article, scientific article, already cleared what are the limitation, the advantage and the disadvantages of the aligner therapy, of the plastic removable aligner therapy. And so, according with these disadvantages or difficulties, we can select maybe the right appliance. Uh, in order to meet the marketing request, you know that instead the full lingual and according also to malocclusion difficulty, today we try to combine the two appliances in order to promote and provide to the patient and, and that we call a hybrid approach that is the combination of the two appliances in according to the arch where there is more crowding and more difficult movement to obtain.
Can I just stop you here? Because I think for it's really important that people, that the audience understands. So which movements are you talking about are much more efficient in terms of lingual braces compared to aligners? Is it expansion? Is it torque? Which movements are really much more efficient than treating them with aligners? Which cases are you talking about are better with lingual braces to be treated?
Uh, mm, Bilingual is much easier, maybe to and faster to move. Of course, all teeth, but to control the full 3D movement of the tooth. Talking about maybe torque control by fixed appliance, lingual fixed appliance is much more predictable movement and much more, I repeat, always faster. By using aligners, you are more difficulty in controlling this movement, or in case of you can have more longer series of the aligner to obtain the same results, and sometimes you do not are able to obtain like lingual orthodontics. The problem that rise is, uh, um, as I told you, aligners it's okay for simple and medium and average difficult cases. For complicated cases, you have many aligners that with unpredictable maybe results, especially in controlling the torque, rotation on the posterior teeth like premolar and molar, expansion, and so and the question that arises for me is how many aligners are acceptable for the treatment to be really efficient. Okay, and honestly, I don't believe, but this is my poor opinion that come from the experience dealing with lingual more than 30 years, treatment with over 80, 90, or 100 aligners. Okay, uh, treatment for me must be efficacy and efficient as possible.
Hi everyone, I hope you enjoy our straight talk. If you want to find out more information about the courses we're offering, they're available on our website, theorthodonticspecialist.co.uk, in our course section. And now we will continue with the podcast. Bye.
So, because as you know, especially if you treat the adult patient or maybe teen patients, the cooperation of the patient. Now there are many articles that state that after 1 year decrease, and if you use aligners, that compliance is one of the most important element to success in the treatment. If it decrease, we can have the compromission of the results of the treatment. So bilingual, maybe even if you have maybe light discomfort at the beginning, that could be an average between 1 week, or 10 days, according to the patient. We can perform very quickly the movement. We can move all teeth at the same time. As you know, by the aligners, at first you have to make the space. Otherwise, you cannot move the teeth if you don't have space by aligners. By fixed appliance and specifically bilingual, you can engage all the teeth at the same time, or as much as you can. So by the wire, and the wire works efficient and quickly with a very light movement. From biological point of view, we can, by using lingual with very light force, we can use light continuous force. Aligners use intermittent force. Okay, which is better? Now we can open a big issue. And as you know, this is look like the football team. No, sometimes we have some people who like intermittent force and like continuous force. But is out of doubt that light continuous force move the teeth more in more efficient and more maybe biological way.
So I think you mentioned quite a lot now the word efficiency. So efficiency, to be clear, means that we achieve a result in the shortest periods of time with minimal effort that we use. So also when we think about our adult cases, and today is not about children, but about adults, most of the time we see a very big curve of SPI, which means that the lower front teeth, they are reclined and extruded. And we know also from research papers that an aligner is a very bad tool to pull any teeth. So when it comes to leveling a curve of SPI to extrude the back teeth, an aligner will always struggle. And I think we already mentioned a big advantage in terms of torque. And when we orthodontists talk about torque, we don't mean crown movement, because what the confusion a lot is in the aligner world is that torque is a crown movement, which is not. A torque is a root movement.
It's the roots movement, of course.
And that is where a lot of people go wrong. They think by pushing a tooth forward, the crown means we apply torque. So when you talk about torque in lingual, you actually mean the root movement. But I think a really important point for people to understand who are listening is when we want to extrude back teeth in adult dentition, that an aligner is not a very efficient tool in doing so versus a lingual brace where we have a slot which is in the bracket, the walls, we call that a slot. When we fill the slot, we automatically actually get correction of this curve of SPI without even thinking much about it. And I think people forget that the leveling, the extrusion of teeth and the torquing of teeth is super efficient. And another thing you mentioned is the rotation, because we know also with the aligners, we can't do rotation on the spot. We always need to apply some push force with expansion or retraction while we do the rotation movements. So there are basically these three major movements, which is very clear scientific evidence that they are not very efficient with the aligners. And this is where lingual braces comes in. So,
but even talking about, sorry if I interrupted, even talking about tip control, angulation control, for me, tip control and torque control are exactly the same movement, but on different on different plane. Okay, usually we define torque control on the sagittal plane, but the tipping is the torque on the frontal plane. And it's always roots movement, and of course for the aligner feature. Control the tipping, any tipping movement is always a problem. So this is the reason why often we need to be helped by some additional tools like maybe attachment, and that of course can help, but not solve. Can help to get the final movement, and it takes time. Time. Stephen, you know very well that one of my goal always in the treatment, especially treating adults, is the make the treatment faster as possible. No, because the adult is a complicated patient. No, because the adult has a dental history, maybe some gingival recession, bone recession, bone fenestration, have maybe implant, many plus apart of this maybe dental problem, they have maybe is his private life, that bring into the treatment, because the any orthodontic treatment go strongly in the life of the young patient, children or the adult, because unfortunately at the moment we cannot go over the biology, and any orthodontic treatment is quite long. We are talking not less than almost 1 year, or 6 months if you are talking about maybe some relapse, but we are talking about maybe an important orthodontic treatment. So the goal is to get maximum cooperation, maximum efficiency in terms of the quality of the movement and timing, and in order to make the treatment non-extraction treatment as fast as possible, in order to keep this kind of treatment within 1 year, or maybe something less.
I think this is the most crucial part, I think, that you said here is the efficiency part in terms of time, because I think we all have maybe 1, 2, 3, 4, 5 cases where we could show that everything is possible with clear aligners. And it took us 2 years, 2.5 years, because we had that one patient who was compliant over the whole period of time. But the reality, actually, when we go every day in our office, is that adults, after maybe 10, 12 months, they lose patience, they lose compliance very quickly, and therefore the result is always suffering. And efficiency means we want to go from A to B in the shortest period of time. So that's why I think it's our duty of care as an orthodontist or dentist that we have this tool in our toolbox, which is called a lingual brace. Because if we don't offer a patient this option, then they might be not getting the full information of what options are out there. Therefore, their consent is actually not valid because they were only given one treatment option. And then they see themselves a year or two later and they didn't achieve the result they actually were looking for to start off with. And I'm sure you as well as me, we see very frequently cases that were treated with aligners to a certain degree, but at the end, they didn't fulfill the demands of the patient. They're raising a complaint. So this always comes mostly down to communication and time. So time is a really valuable thing. It's the most valuable thing we have. So I think it's really important that we understand that. But also for people who don't know, Giuseppe is also an inventor of actually two bracket systems himself, which is called the FTB bracket and the Alias bracket. So I want to know, obviously, let's talk about the Alias bracket. The Alias bracket is, you might know from the buckle world, the Damon brace, which is a metal bracket which has a slide to close the slot. And Giuseppe actually invented a similar bracket, but on the inside of the teeth, which is called Alias bracket. Why did you invent a passive self-ligating lingual bracket with a square slot and straight wire? What was your thinking?
Thank you, Stefan, for mentioning the appliance. Of course, Alias is a commercial name, but the main concept was and still is the square slot, because we found that using the square slot with square wire and especially at the beginning of the treatment, during the leveling stage, using round wire, the round wire in the square wire has the advantage that can move in all the direction with the same amount of play. Okay. If you use the conventional rectangular slot, even in lingual, we have a 2-dimension in the slot. Okay. Usually we have a 18 by 25, or maybe opposite, and in lingual with another technique, we have a 25 per 18. Okay. And according with the two different slot angulation, vertical or horizontal, we can have in both situations some disadvantages. For horizontal slot, we can have difficulty in control, maybe the rotation, where with the vertical slot, we have difficulty in control, mainly in control the tipping. Okay. And the other problem are where you talk about why passive self-ligating. We in both the slot, the different slot angulation, we have the conventional ligation, metal or elastic ligation, and the ligation become an active part of the treatment. Okay, and the quality of the ligation is related to the skills of the doctor, the ability of the doctor to make this ligation. And if ligation is properly correct, they can imply an insufficient maybe wire control in this kind of movement. Horizontal in rotation, vertical in tipping, and in both in losing during especially the main measure mechanics space crucial in case of the extraction case, losing the torque. Okay. By using the passive self-ligating with the square slot, we cut part of this problem, because when you close the bracket, there is no anymore maybe difference in ability to the doctor. I close, you close, and other people close. It will be exactly the same, and the wire will be surely seated in the deep of the slot. Okay. This was one of the main reasons. In addition, of course, these were maybe more mechanical concept. In addition, they are maybe easier and faster to place and remove the wire, and also much more comfortable for patient, because you cannot run with metal ligation that imply I repeat, maybe ability. You have to bend the wire. You have to do something that can give him probably some patient discomfort. Of course, always is related to the ability to the doctor. So by using passive, we can cut part of this problem. This is for control at the shell, but mainly is the advantages, my mechanical advantages of the square slot. Please also consider that during the space closure, the wire in lingual tend to go out from the slot in opposite direction when you use labial appliance. In labial appliance, when you perform the space closure mechanics or en masse retraction, the wire tend to go in the slot. In lingual, the wire tend to go out. This is the reason why I say that ligation is an active part of the treatment. You cannot relate the anterior teeth control to the ligation, especially if you delegate, okay, as many orthodontists do to the nurse, to the staff, this approach. And this is the main concept.
I think, like obviously, as you know, like I was a really big user of Incognito before, which is the other system where you just mentioned with the vertical slot and the horizontal slot, which was highly depending on the ligature and the skill of the clinician to have ultimate control. So, and if I think we need to consider that aspect as well as the qualities of an elastic element, because obviously most of our users, they use a normal O-ring, a rubber O-ring, and within a day or two, it has only half of the force left to actually hold a wire in the slot. And most of our colleagues, they see patients every 6 weeks or something like this. So for a long period of time, it could be that the wire is completely disengaged out of the slot, which then we lose again efficiency. And this is where I think a lot of the bad reputation of lingual braces comes from, that clinicians lost control over their case in terms of tip or extraction case. They got bowing effect because they couldn't control the slot and the wire engagement with ligatures really well. So I used to be clinical advisor for 3M. I dealt with a lot of clinicians in Europe and Middle East who had problems with their cases. And what I've seen at that time was that a lot of the problems were self-inflicted while they're moving the teeth. So they created actually a tip problem, where at the beginning of a case, there actually was never a tip problem. And why? Because they moved the teeth along the wire and they lost control. So with your bracket, with Alia's bracket, with the clip, like you mentioned, this is independent from a user. You can close the clip and then everyone is the same and we have much more control. So that I found is the biggest advantage. And also from a time perspective, time is valuable. Like I have young associates in my clinic now who I train in lingual braces. And obviously if clinicians come to shadow us and we do a lingual bond up in maybe half an hour or 40 minutes or whatever it is,
Yeah.
And then they seem to believe that everything we do looks easy. And then they do their own first case, they do a first bond up. They see themselves 2.5 hours later, still in the chair, trying to get a wire in. So we need to be all aware that lingual requires skill. Lingual requires a lot of education. We need to know exactly what we're dealing with. But if you understand how lingual braces works, it is for sure in the right hands like us, the most efficient tool that is out there. But I want to change a bit the topic because also we know each other from lecturing about lingual braces for a long time. But now, about 1 or 2 years ago, you seem to change, that you get much more open to aligners. So obviously, I believe for you, because you invented lingual braces, you created that story, this hype from the 1997, 2005, where lingual was very popular, very famous. It seemed to be the future of orthodontics. You also seen that with the aligner pushing into the market, that the demand for lingual is decreasing, that you as an educator, you used to speak in front of hundreds of people. You wanted to inspire, to do lingual braces, to use the most efficient tool. You have seen as well that the numbers for lingual congresses are decreasing rapidly. Why? Because it seems to be not a sexy device anymore, too complex, too difficult. Also, having said everything we said so far. So, what was it for you that you actually said, okay, I need to open up now to aligners? And what made you make that switch to aligners?
But the problem is, what do you say? Uh, Today aligners become more and more popular, and as I said at the beginning of our talking, was aligner works very well for easy cases and medium average cases. And Stefan, you practice lingual since many years, and you know that the majority of the doctor who practice lingual use it for maybe simple average case. Very few doctor use lingual for very complicated cases, okay, around the world. So according with this, we can understand the reason why aligners become much more popular and much more easy to manage, even because aligner embrace also all the world of the general practitioner, not only specialists. Okay, and the other point is. And I repeat, for PC case aligner is nice. Even if you are maybe lingual specialist in our office, and we are specialized in lingual invisible orthodontic, we have many aligner requests from patients that they want to solve the dental misalignment problem and in a quickly way. And sometimes we use aligners and combined with lingual because and we call this approach the other option maybe. And the other option is not only aligner, is not only lingual, but maybe the fusion, the mix of the two technique, where we can get the best of both, because aligner are also many advantages, and knowing the advantages and the disadvantage of both appliance, we can get the best of both, and using according to the case difficult. I think the combination in hybrid is a boost for the aligner therapy. I don't see the hybrid as maybe an enemy of the aligner therapy. No, I see the allied of the aligners. Okay, and I repeat, can offer to the aligner approach more chance and more possibility to improve the quality of the treatment in the shorter treatment time, always with the goal, with the light of the treatment efficiency. Okay, and this is the reason why we call hybrid treatment the other option. But I want to also clarify maybe the terms of the what's meaning hybrid approach. Okay, because many people intend the hybrid approach. I treat at the beginning with lingual or with labial appliance, and then maybe by the end of the treatment, I remove the appliance and I use aligners for the refinement. Okay, for me this is not, but this is my opinion, is not an hybrid approach. For me, this is the two-phase treatment. You understand? Because you use two different appliances in the two different moments of the treatment. When I say hybrid, I say using two different appliances at the same moment. Please think about the hybrid car. Hybrid car means that you are using the car and in two ways at the same moment. Okay, electric or with gasoline. Okay.
Hi, I hope you're enjoying our straight talk so far. If you're interested in any mentoring or one-on-one session with me to discuss cases or any questions you might have about the treatments of your patients, please reach out to us in our mentor program. We're offering that. We have more information. It's on our website, theorthodonticspecialist.co.uk. And now we're going back to our podcast. Bye.
So,
I have a question, Giuseppe. Like if you talk about now the hybrid approach using maybe an aligner in one arch and a lingual brace in the other arch, how do you make sure that the two different systems communicate with each other? Because obviously, if I think about, I have one technique in one arch with a certain arch shape and another technique in the other arch. So how do you establish that the two arches treated with different systems are communicating with each other?
Yes, you're talking about the coordination of the system. Okay, at the moment, this is one of the problem because not so many company now are able to provide the hybrid approach on the same platform. Okay, but now more and more they are thinking to enclose in the aligner platform all these maybe options. In order to offer to the client more possibility to run in with fixed appliance that could be even a labial appliance, but obviously we are talking about invisible appliance, and I think that the best marriage with aligner that almost invisible is lingual, is not labial. This is the reason why I use the combination of these two maybe invisible appliance. No, not so difficult. You know that I do by myself because I developed the system to do it by myself. On our digital platform. But soon will be available also in other platform or other approach. I think this will be the new maybe new concept to run in invisible orthodontics, not only aligners. I repeat, or not only lingual, but the combination. No. As you mentioned, if you mentioned the difficulty by the aligners to level the curve of speed. But if you use aligners in the upper with the anterior bite ramp and the fixed appliance lingual in the lower arch, you can solve really quickly the crowding and leveling, extremely quickly the curve of speed. Okay, because by exploiting the upper bite ramp in the aligners, you have a posterior disclusion, and by fixing it is really easy, okay, to extrude to level the teeth. So many possibility, many option. I treated many cases with the hybrid, even complicated cases, and honestly, patient likes very much, because I repeat always, the timing of the treatment is one of the key to attract that become attractive for the patient. For me, from my experience, the patient ask. Now, just to maybe simplify, but the patient usually ask three things. First, invisibility of the appliance, okay, or less visible as possible. No? Second point, timing of the treatment, okay. And of course, we give for granted the results, but this is the basic concept for all treatment, you know. But the third point is maybe sometime it costs, and this for me was really important after small investigation. This is why I told you about this three point, because I always found maybe quite nonsense when I talk maybe with some colleague that say, I don't do lingual, I don't do this because is too expensive for patient. This is not absolutely true. You don't do lingual because probably you are not able to manage this approach, this technique. And for the patient, the cost is not the primary. If you are able to satisfy the first two requests, okay, and a patient are willing to accept the treatment, okay.
I think I want to support you in that, because also what's happening nowadays is that with the growing demand for aligners and the options given to adults with aligners, the prices actually, especially here where I live in London, they're very competitive. So the prices of aligner treatment are dropping massively. And when you give the patient the options of having a true invisible treatment option with this much more efficient in terms of time, and then you talk with them about the price, which is higher, yes, than an aligner treatment, but you could also then justify the higher price bracket because it requires much more skill for you as an orthodontist to be in control with the lingual brace than having aligners with attachments on the teeth. So that helps you actually nowadays, that the price difference between aligner and lingual is because it requires us to spend much more time on a patient versus an aligner treatment. We can nowadays, with remote monitoring, we can outsource it completely, that we actually don't need to see patients anymore. So actually the market in that respect helped us, that in adults, like you will probably agree with me, is most adults I see having lingual braces, because the most important thing for them is the result and efficiency. The cost is important, but it's not the deciding point for them. They want efficiency, and they want to be able to trust you that you achieve the goal very quickly. But I want to touch another topic, Giuseppe, and like there's also with aligners, obviously we have now two major companies, maybe three. We have Invisalign, we have Spark, and we have Angel Aligners. So I know that you recently joined Angel Aligners. So why did you join Angel Aligners? What was it in the company that you found so appealing for you as a lingual specialist to join Angel as your company of trust in terms of clear aligners?
I tell you clearly. First, because we increase the aligner treatment because the demand in our office is also increasing for the aligners. And I had the chance to meet to know maybe in deep this company Angel Aligners, and I found really I can say maybe more closer to my idea to how to weigh how to treat patient, especially regarding the quality of the setup. Uh, you know that all lingual appliances need to use indirect bonding mainly if you want to place correctly the braces and if you want to have the good control. But this is maybe is the basic concept with any fixed appliance, even in label. The right bracket position is one of the key of the success of the treatment. In lingual, we always use in indirect system by using setup approach. Setup is look like a simulation of the treatment and a virtual simulation of the treatment that many years ago we made by manual with the plaster model. Today we do by the digital, and even the quality, the setup is important in order to give maybe best occlusion and the functional setup, because we are not only straight teeth, but we are moving, we are combining upper or lower arch in a functional problem and functional movement in order to give the best occlusion as possible. And having visited the company, and I was really surprised about this capacity of the company to deliver the high quality setup. And software of the Angel Aligner probably at the moment I think they're one of the most advanced, and software for clear aligner. And the other bigger advantages in their platform also that they have, we use also for our legal cases, all the diagnostic section and in the platform to make all the to enclose all the records, to make all the cephalometric analysis, superimposition, and to combine with all the photograph records that we constantly register during the treatment. And more and more things will come in this new platform, but mainly, I repeat, for the and but not least the quality of the service. They are able also to provide really a good service, means to deliver faster and high quality plastic material. Okay, at the moment.
I have one more, also another question. Like you mentioned function and occlusion, because obviously for us in the academy, we're teaching now. I see Christian here is also joined our core in our lecture now. He's also one of our teachers. We are very big in terms of function occlusion, that we don't look at static situations and we don't trust a cartoon that is being shown to us. But I want you now approach a different, maybe new topic to you, airway. So, as you know, you spoke to me now several times. Where do you see this topic of airway is happening, what's happening at the moment in the market, where is this going, what impact does that have eventually on our treatment planning in orthodontics? Because you travel the world, you know the people everywhere in the world, in US and Asia, you've met them. So where do you see this topic airway plays a role in our orthodontic planification?
But I think will become one of the main topic, one of the main point to be analyzed at the beginning of the treatment, during the diagnostic part of the treatment. I think the doctor need more and more awareness about this, and need to be maybe educated about the airway function for the breath and for the maybe quality. I think and I think that the right word for the quality of their life. Because if you can breathe correctly, you can have also your quality of the life, health quality of the life much better. And so often is undervalued, but because many doctors don't know correctly, okay. And according with this, in the diagnostic part, we try to reduce more and more extraction, or even because our skeletal typology offer more chance to treat the patient without extraction than extraction. To limited extraction in only very few, really few cases. If you do extraction, we can reduce the room for the tongue position, and tongue go in the back position, and can worsen the possibility to breathe correctly. Okay. And so this is maybe for main concept. Of course, we don't have time to go in deep exactly on this, but more or less is like that. Okay.
I have
So
one final question for you. You are now, maybe if I am allowed to say it, at the end of your orthodontic career path. You have a young son, Giacomo, and he's more and more taking over your private practice in Rome. Where do you see is the future going in orthodontics? What will be the main challenges for us as a specialty in orthodontics? Where do you see is this journey going with the more and more dentists doing orthodontics with aligners? There's more competition. So how do we as a specialty survive this development? What is your vision in the future?
Honestly, if you want to do the right orthodontist, you need to be specialist. The reason why, or you need to focus mainly on or especially or exclusivist. Okay, you need to be maybe the learning curve about not only how to move the teeth, but all the craniofacial approach, and some specialists now now call orthofacial approach. Okay, and orthodontic is not only align the teeth, move the teeth. I think more or less everybody, even the nurse that we have in our office, are able to move the teeth, because they bond the brackets, they put probably the wire, and probably better than us because they do only this. No, but aligning only teeth and give a right occlusion, a right function. When I say right function, means also not only occlusal function, but possibility taking into consideration also the breath problem and everything, is something that can do only who focus mainly about this approach. And an orthodontist, I say specialist because during their orthodontist career, they studied all this. Sometimes not in depth, but they have the knowledge about that. No. Today, maybe aligner gave the possibility to do basic orthodontics and not functional orthodontics to everybody. No, this is the reason why I think that our job as a specialist will still survive. Will not have any problem for maybe for the future. No. This is my opinion. No.
Is there a question you would like to ask me? If you could ask me a question, what would it be?
No, the question is you recently in this last few years got a lot of interest about what we talk now, no, about the breast, about the occlusion. You spend a lot of effort. When I say effort, not only your personal energy, but money and everything, including money, to travel around the world to learn in the COI Center. No, many new things, and it still continues to learn about that. I admire you because now having got this principle, you want to spread this. But why? Because you're not jealous. This is why I admire you. To spread in order to provide to the doctor more information in order that they can perform the treatment for the patient correctly. Okay.
I think this is, you mentioned that, like, I dedicated a lot of part. I mean, it all started when I met my wife, who is a COIS credit 7 years ago, where she created awareness that the cases 30 years after they completed orthodontic treatment, they might have had a relapse, they might have had destruction on their teeth, they might have had different symptoms, but they had orthodontics. So the question arises then, what did we do wrong as orthodontists that it comes to that situation 30 years later? And when you then meet John Coyce, who is one of the most humble people in the world as a dentist, and he's one of the most educated people I'm ever met because he's full of science and evidence. And he said to me that maybe it starts also earlier in life, which is with the children. That is when I kept thinking, wow, we need to go back to what we learned, what we're doing every day with children to see eventually the first signs of a destructive pattern. And the destructive pattern means not only teeth related, like wear and chipping on teeth. It can also be relating to their sleep, to their behavior, their concentration, their mental health. And when you then start digging deeper into these topics and you do interviews with different people in the world who talk about this, you get the understanding that we as orthodontists have a huge power. And that means we are in an area where bacteria go in, where air is going in, where a lot of things are happening at the same time. And if that is out of balance, it has an impact on teeth. So the teeth are only a symptom of something much deeper that is going on. And one of the main things that I see more and more is that children are suffering. Children, they're struggling to sleep. It could be because of a tongue tie. It could be because of narrow arches. It could be because of a crossbite. And the parents are concerned and they're seeking help by dentists or GPs, but they're not getting any. They're getting told there's nothing we can do for your daughter, for your son right now. They have to wait until they go in secondary school. That means for 5, 6, 7 years of their life, they're suffering.
Yeah, but this is why before I told you we have the possibility, and I say the honor, because we should be proud that we have the possibility to improve the quality of the life of our patient. Uh, that means not only a good smiling, but behind the good smiling there is a big word concerning all the function, breathe, and maybe sleep very well, as you say, the concentration and many things. And this really can modify in a good way the quality of the life of our patient. You treat many young patients, Stefan. You had a lot of experience, and you had the possibility. You saw how they change, even their character and their attitude. After they can breathe, can sleep well, can breathe correctly, they can have more oxygen in their blood. No, they can have more attention. No, they are not suffering anymore. They lose this attitude to be apathic. Okay, so and we are moving teeth. Yes, we are moving teeth because we are not, how do you say, we are not doing miracle, but we, the goal is moving it in the right and correctly direction. This is my goal. No.
And I think to summarize this podcast is as well is we shouldn't be just thinking about one tool in our toolbox. We should think about different tools. And sometimes we have to combine different tools like Lingual and Aligners to get to the goal as quickly as we can, because when we achieve a goal quicker, we can make quicker an impact in the life of a patient who's trusting us to do their treatment with. Thank you so much, Giuseppe, for your
Thanks,
time
Stefan.
tonight. And I hope we learned a lot, and I hope to hear you soon. Thank you very much. And I really appreciate it, Giuseppe.
Thanks for inviting. It was nice to exchange opinion and about orthodontics and about the different vision of our profession. No, and the, this is always nice to talking with colleagues that have your same idea and the same approach. Thank you again. Thank you
Have a
all the
nice
people
evening.
that listen us. Okay.
Bye.
Bye. Have a
Take care.
nice
Ciao.
night. Bye bye.